copies of the report. Should you like to request a physical copy, we will have that option to request one after we conduct the poll. The report can also be found at lifefdlc.com or on any of the report partners' websites. Just to briefly recap today's agenda, we will introduce the report, talk a little bit about what it means to our community. Our incredible panel will discuss, and you will have a chance to answer some or ask some questions as well. And then we'll have some closing remarks, and as I mentioned earlier, the poll at the end. Before we jump into the report's findings this morning, we'd like to explain the history of the LIFE report in the Fond du Lac community. For those who aren't familiar with it, the acronym LIFE stands for Leading Indicators for Excellence. In 2008, the Fond du Lac Area United Way commissioned a LIFE report for the local community. Through our strategic planning efforts, we explored the option of renewing this report, but we knew that having additional partners would expose the report to many community stakeholders and embrace the spirit of collaboration. The LIFE report is one of the tools used to access the needs of the demographics of the community. The report is used by the United Way, among other funding organizations, to evaluate the data and support and guide our understanding of the community, as well as determine funding. Our work is based on real-time data and research. As we review the current report findings, we will work with the program and agency partners to continue to work toward meeting and identified needs within our community. We intend for many groups to use these findings, from businesses recruiting employees, to nonprofit agencies planning services, to local governments deciding on resource allocation, and even coalitions addressing areas of need. The general public could also use this to increase awareness of community strengths and challenges. Now for the best part, I get to introduce our incredible panelists. Our first panelist, Larice Snyder from the Fond du Lac School District, has been in the community since 2007 and currently serves as the District Equity Coordinator and Compliance Officer for the Fond du Lac School District, where she leads system equity changes. From 2016 to 2019, there's Larice on the screen for you. Larice has served as the Diversity Relations Manager and Equal Opportunity student for Moraine Park Technical College, and for almost 10 years prior, provided direct services to students and families at the Fond du Lac High School. A Green Bay native, Larice received her BA in Sociology and Spanish, with an emphasis in social work and control and deviation from the University of Wisconsin-Stevens Point in 2005. In 2012, Larice earned a master's degree in cultural foundations in education from the University of Wisconsin-Milwaukee. She has served the community as a board member for the Fond du Lac Area United Way, Fond du Lac Area Women's Fund, and Girls on the Run. She's also served as a National AmeriCorps volunteer, as well as Boys and Girls Club program director, and finally, a YMCA family camp director. Our next panelist, Dr. Sachin Jogal, is from SSM Health. He is new to the community. Sach Jogal is a board certified pediatrician at the Fond du Lac Regional Clinic of SSM Health. He joined here in August 2020. He co-chairs Element 3, the physical health portion of the comprehensive service integration of the Fond du Lac County. Prior to that, Dr. Sachin Jogal has also had extensive experience working with the community stakeholders such as schools, churches, businesses of underserved areas of Memphis and northern Mississippi to help reduce barriers and disparities that affect children's health and social success outcomes. He is on the board certified. He's also board certified, by the American Board of Obesity Medicine, and was the medical director of the obesity clinic at, I'm gonna totally not say this right, Le Bonheur Children's Hospital in Memphis. Is that right? We'll just roll with it. He is currently a fellow of infant, early childhood and family mental health capstone certificate program at the University of Wisconsin-Madison, which is a truly incredible thing to be doing. Next on our list, if you could pull her up on the screen, Sarah Faust from the Fond du Lac County Health Department. Sarah serves as the Community Health and Prevention Supervisor at Fond du Lac County Health Department and has been with the health department for 4 years. Sarah's main role is coordinating a community health assessment and community health improvement plan in collaboration with healthcare and community partners, as well as additional health promotion efforts and initiatives. She earned a bachelor's degree in community health education from the University of Wisconsin-La Crosse and currently lives in Oakfield. Last but not least, our final panelist is Jim Cleveland from Envision Greater Fond du Lac. Jim serves as the Vice President of Economic Development and has been with the organization for 14 and a half years. Jim was born and raised in Fond du Lac, says he's a recovering banker, and is pleased to serve the business community of Fond du Lac County. Jim oversees a wide variety of economic and workforce initiatives, in addition to working closely with the Fond du Lac County Capital Resources to provide gap financing for businesses that desire to expand in Fond du Lac County. Thank you to our panelists for being here today. We would like this session to be as interactive as possible, but we are asking that you hold your questions until the end of the panel discussion. We will monitor the chat box for questions and we'll do our best to answer each question before we close this morning. Should your questions remain unanswered, we will capture those questions from the chat and ensure that they are answered in a timely manner for you. So without further ado, we'll get started with the questions. Panelists, everybody ready? Can we get everybody's mics unmuted to be able to answer? Thank you. This first question I'm going to throw out to all of the panelists. How will your organization utilize the data in the life report to advance the community, or if you could share a success story your organization has had in advancing one or more of those indicators? Jim, would you like to go first in responding to that question?
Good morning, everyone. I'd like to again thank all of you for taking time out of your busy day and on this first snowy day in the 2021 holiday season. So thank you again for being with us. So Envision Greater Fond du Lac views this work for our community really as critical. We need to make sure that we understand where we are, and maybe more importantly, use the data to formulate strategies, tactics, to address those areas that are perhaps deficient, and likewise promote those areas that the Greater Fond du Lac area excels in. We use this data when we're looking to attract not only workers, but also businesses to the county. And furthermore, the data provides critical support for attracting funding as we formulate those strategies and tactics, no matter if we're looking at internal to the area with local stakeholders or to outside the area with grant opportunities. Perhaps the first step is always understanding the need so that we can communicate it well to stakeholders and or grant opportunities. We do have always anecdotal evidence as we as an organization go out and talk to our business community and our local officials. But we also realize that we need the hard data to support that anecdotal evidence. For example, I can tell you that earlier this year, Envision Greater Fond du Lac, in partnership with Fond du Lac County, embarked on a countywide broadband survey. And what we did is we surveyed not only residential homes in the community as well as businesses to identify gaps and really put some quantifiable numbers to the need. And not surprisingly, we found that there indeed is gaps, especially in the rural parts of our county. We had over 1,500 unique responses to that survey, which is really a huge accomplishment for the county. The people really stepped up and responded to that survey. We've used that survey to roll up to a new north, which is our 18 county regional economic development initiative to apply for significant federal grant dollars. Fond du Lac County is also embarking on a broadband expansion and much of that data can be used in those efforts as well. Going forward, we're embarking on a child care survey. We recognize that child care is a need in this community from a capacity standpoint. So we'll be looking at that. In fact, some of you probably already have a survey in your inbox, I'm hoping. If you are an employer, please take time to have your employees do that. Going forward, in addition to the child care, we're looking at housing as well as transportation. So all of the information in this life report really is the springboard to a lot more future programmatic activities and data mining that we'll be doing.
Thank you so much, Jim. Larice, would you like to weigh in?
Sure, yes. Hi, good morning, everyone. Thanks for joining us. Yeah, I concur with everything actually Jim just shared. Being in the field of education and really our educational systems being a strong foundation for everything in our community is really important. And so all of the data that we see here in the life report, and also knowing that we are monitoring our progress and our growth, from time to time, as you talked about, being a point in time, and then where are we at to really as a measure that really helps us. From the school district point of view, just really how do we partner and really have meaningful collaborations. And so this report and really talking about the quality of life, absolutely that impacts our families, that impacts our students. If our families don't have a high quality of life, it's really hard to be receptive to, really rigorous learning and having our students and our families be at their best when they're able to show up for the school. Really thinking about health and wellness. Again, one of the partnerships, I think a success story, we had a great opportunity with the United Way and with the health department to engage the community in applying for the health equity vaccine grant, which I think was a huge success, already having a lot of strong partnerships that already existed. And so bringing everyone together around this specific cause, I think in a very short period of time, we really realized much success, and especially in communities that are typically underserved, communities that historically have experienced marginalization. Having those strong connections is really important. So the information is telling us how are we doing, not only in our community, but then how are we doing in other communities, and what do other communities perhaps offer that we could look to, so for our own growth. So Jim just talked about the childcare. It's a huge concern in our community. Our students, their earliest foundation, earliest introduction to education, having a safe place, consistent for children to go to, really sets them up for success in how they experience K-12 education and beyond. And so really, I think our role being the educational system is just how do we continue to make connections, and how do we continue to have strong collaborative efforts that really set our community up for success. And it absolutely takes all of us working together, and also really being understanding how our school system works and how we can grow in that way. How can we make sure each and every learner is reaching their fullest potential, so that they're contributing in ways that they find meaningful in the community, into their families, and beyond. So it really is just the foundation of everything we do. But I'll stop there and let some others weigh in.
Larice, thank you so much for that response. Again, the question is, how will your organization utilize the data included in the life report? Or if you could share a success story. Sarah, would you like to respond as well?
Sure, thank you. Good morning, everyone, and thanks for having me this morning. And just to build on what kind of Larice and Jim talked about, is the life report really does paint the picture of the many factors from the different areas that do shape our health. So all of these are interacting to create those health outcomes. So really, when we look at advancing health in those areas, shows the importance of all the sectors needing to be active partners to move that needle in a positive direction. So looking at the life report, I think one area that we can reflect on that we've made progress in over the years is as we're working to address many of the indicators like smoking, alcohol use, obesity, and suicide prevention locally, one where we see progress in is the number of adults who report to be current smokers. So while smoke-free clean air for everyone has long been a public health priority, it wasn't the responsibility of that single sector, but really it took everyone to be recognized as a collective responsibility to make progress in advancing those smoking rates, whether that's at the local or state level. So I think that just shows how we need the support of all community partners when trying to make progress on any one indicator. And I just think that's a good reflection to have, and looking at how we can do that among other areas.
Thank you, Sarah. Satch?
Life report to me is an objective way to kind of look at the indicators for excellence in this community. And that itself is a value to healthcare. And for instance, we see as this COVID pandemic continuing, that is a toxic stress for every community member from child onwards to elder adult. And that creates a mental health issue that we all have detected, including in my office, the need for more mental health providers, access, and so forth. So the life report gives parameters as to what the current status of, let's say, mental health providers is, which we can use towards kind of as indicators progressively to create, including projects in SSM Health that I'm in, or throughout the community as inclusive providers of various aspects of mental health. And then asking these parameters we can use to look for support as evidence for the need of how much need we have. In my office, I see patients, some of them, I see the urgency of them needing mental health referrals. And I see the frustration that I have and the families have of how long it takes to eventually get a referral. So that is in a way, an indirect indicator, but the life report gives an objective indicator as to the numbers. And it compares them to multiple counties within Wisconsin, as well as the whole US population. So how do we compare to the other areas within Wisconsin and the US? And that paints a nicer picture to objectively put it out to the funders such as United Way and so forth to say, hey, you know what? We need this and this help, and this is our action plan.
Thank you. Thank you, everyone, for giving your input on that question. Moving on to our next question. Sarah, I'd love to hear from you on this. How are the changing demographics impacting the services of your sector?
All right, just getting myself unmuted there. All right, so I'd say, over the last few years, we've focused on adding additional outreach methods and working on how we communicate with our community. So we've recognized the need for more communications in other languages such as Spanish, and really work closely with our interpreter and translation services to make sure we have all that information available in those other languages. We also have done more virtual updates and social media communications to really meet our audiences where they're at, and also recognizing that we serve people across all demographics, and it's important to really meet that person where they're at in terms of outreach and communication. So with that, we've also recognized over the pandemic that through the Vaccine Equity Grant, that there's different groups that may be experiencing increased challenges or barriers to good health. And we've seen this throughout the pandemic, which brought those existing health equities into light. So for example, we've reflected see this reflected through the data on who's impacted by the COVID-19 and which populations have higher case rates or lower vaccination rates. So, and as Larry's mentioned, we looked at that as that opportunity to work with additional partners through the vaccine equity grant, which was project focused on reaching out to those populations and building partnerships and relationships to really make sure we're able to reach everyone with that credible information and increase access to COVID-19 vaccines. So that's something that we continue to look at working on as we continue our response to the pandemic.
Thank you. Our next question is how do cost of living factors influence a company's decision to locate or grow in a community? And I'm going to ask Jim to reply to this question.
So yeah, again, I don't think it's any surprise to anyone on the call this morning that talent attraction is probably the number one, not probably, it is the number one focus of companies. And it's the focus of a company that's already here. It's the focus of companies who are looking to relocate or to establish second, third, fourth locations. They're always looking at talent. One of the metrics that they use is certainly cost of living, right? So it's always going to be a factor when companies are looking to locate or expand. They want to look to see, can they attract the talent and will their employees in those communities be able to afford things like housing, groceries, utilities, all of the things that we in our day-to-day lives need to have. Overall, this report, when you take a look at it, we are below the national average in cost of living as a composite. Now, when you look at some of the individual statistics on page 16, things like healthcare, utilities, groceries are slightly above the national average. But when we take a look at the overall, it's the composite that remains below, which is positive. And, you know, I think one thing that all of you will see a big jump in is the housing. That's not a surprise, right? Housing across the United States is significantly on the rise, so the cost of housing is increasing. But when we receive requests for proposals in from site selectors, brokers, companies, many things come into play. You know, one of the things they look at is, you know, first of all, you got to have the dirt, if you will, right, to put up a building. But then it's also looking at things like logistics, supply chains, utilities. But really, I can't stress enough to you, talent is huge. So for us to be able to show that our composite cost of living is less, that is a plus for our community. So we need to continue to monitor cost of living because it plays directly into talent attraction. Again, whether it's an existing company here or someone looking to locate.
Thank you, Jim. And yes, you are spot on. As a hiring manager myself, I am feeling the need for talent acquisition. We're going to keep moving on because we are 2 minutes ahead of time. Satch, the next question is going to be for you. There are two analysis data for our Fond du Lac community, the community health assessment and the life report. So some, you know, kind of question the value of having potentially duplicating this data, if you will, between the two reports. Do you, Satch, see them as both being beneficial or are they redundant?
Thanks for asking that question. And I questioned that myself, actually. So I thought it through, and from, I guess, in a way, and still an outside perspective, me being new around here, I've, by the way, Rebecca, if you lose me on this computer, I have the other computer open so you can change my, whatever it is. All right.
Well, let's check in.
Okay, so I see, number one, that the life report is more objective. It has objective US Census-based data, Wisconsin state board-based data, economic and labor statistics, U.S. Department of Agriculture, so it has these objective parameters that you can kind of get the data for Fond du Lac, and the same type of methodology to get data from other counties, as well as comparing them to the overall US data is on the same page. So that is a big, I guess, a difference that I see between the life report and the community health assessment data, which is more, to me, it's more subjective, self-reporting through paper-based / online-based surveys and so forth of the Fond du Lac population. But I think it has value. Each report has value to Fond du Lac. So comparison of data is mainly the life report gives the comparison, an objective comparison to multiple Wisconsin counties. And there's also within the community health assessment some comparison of some of the parameters that have been evaluated through the survey to the Wisconsin state as well as the US, but they are not necessarily the Wisconsin state data, for instance, and the US data is not based on the same surveys. So it's hard to compare apples to apples. They're not that. So in terms of utility of these two reports, I see the CHA survey data as being valuable because it's more personalized. It's surveys, individual surveys within the community members and their responses according to their experiences. And it brings an insight into what the community's own needs are and the preference of the community's priorities and so forth within the community. But it's hard to compare this data, let's say obesity rates, or how much access do I have to see a dentist, to overall Wisconsin or US data. So and therefore it's valuable, the community health assessment is valuable to give us priorities that we see as a community that are important to us. For instance, getting those top 3 priorities in the last month or so for the next phase of our what we do. We have come to that conclusion based on the survey data, and that's great. While now we take that goals, those 3 goals, when we create action plans for those goals, we potentially need funding and resources to achieve those goals. And for that, subjectivity into trying to have United Way, for instance, or Fond du Lac Foundation to give grant support, they need more objective data and comparison data for which the life report is useful for. That's what I got out of it. Sarah, if you want to say anything or.
Yeah, thank you for that. I'd love to turn it over to Sarah and see what she thinks about the 2 reports being beneficial or redundant.
Yeah, thank you. And I think Satch did a good job explaining kind of the differences in those reports. So the community health assessment, just to give everyone on the call a little bit more of a background or overview of that, is a community health needs assessment that local health departments and hospitals are required to do. So local hospitals looking to do that every 3 years, and the health department required to do that by state statute. We work together really closely in our community to conduct that assessment together. And like I said, every 3 years. So the community health assessment has been around for a number of years happening in our community, which has long been identifying needs in the community to address, as Satch said, in a community health improvement plan. So looking at mental health being identified as a top priority, chronic disease, substance use, and previously dental care, access for dental care. So recognizing those are our community needs, and really in that assessment process, looking to hear the input from community members themselves directly. So what are the challenges that they're experiencing to health? What are the barriers and kind of those local conditions and lived experiences of our community members? So once we have that data and a better understanding of those challenges, we can address those directly in our community health improvement plan and work better together to really improve that, those health disparities or inequities that they're experiencing. So for example, in our last community health assessment, we really went out to the community to hear more from the various populations in our community. So Black, African-American, Hispanic, our white residents, individuals with limited assets in the recovery community, the rural, the urban, really to get that broad array of what our experiences across the different areas of our community, and really then be able to utilize that information of what we heard to then address those needs. So I think the health assessment gets a little bit more, digs a little bit deeper into some of those challenges or barriers, versus the life report is, like Satch said, that comparison at the county level to counties similar to us that maybe we could see what are they doing in their community that perhaps could we tailor that to Fond du Lac County and implement it effectively. So gives us that idea for innovation of areas that maybe we have to improve in. So I think overall, they have, like you said, different values in them, and maybe some similarities in an essence, saying this is why we need all sectors to work together. These are the various factors that impact or shape our health, but really helping to move us to that next step of planning and action to address those areas that we'd like to address together and collect on a common agenda. So I don't think I have anything else to add there.
Thank you. And I'd just like to note, Sarah did send the link into the chat for that survey if anybody is interested. Moving right along, I'm sorry, Sarah, but I'm going to ask you to answer this question too. What successes have you seen among collaborating community partners to improve the health in Fond du Lac County?
Yeah, I have two examples that I like to share. So recently, as we've been addressing the pandemic, I think it's a good example to highlight of how the health department team worked closely with other sectors such as healthcare, education, and businesses throughout the pandemic. So in that initial response, our team did meet with Envision Greater Fond du Lac, and both recognized early on it would be beneficial to have a group come together during the pandemic as a way to share local updates and guidance. So through that, a reopened Fond du Lac County task force was open, and we met with schools regularly in the education sector to really discuss mitigation strategies, what are those current recommendations, and the platforms to utilize for sharing all that information. And I'd say this was a success because it really did allow for a joint approach among the different sectors to share that credible information quickly with a large portion of our community, and really enforce those key messages on to how to best protect the health of employees and community members. Another example that I'd like to highlight would be the Healthy Fond du Lac County Steering Committee. So this is a group of community partners that come together to oversee that community health improvement process, which, as we discussed, is the community health assessment and improvement plan. So to oversee what are those top needs and sharing updates on what strategies are being implemented to address those concerns. So this has been a successful collaboration because it allows open communication among partners. And I'd even say one example that to take from that initiative that's made progress over the years was the access to dental services. That was identified as an issue among children with Badger care or medical assistance, and even led to the creation of the Save a Smile dental program. which allowed that program to partner with local dental providers to see that population. So some of the issue was that dental providers not wanting to accept the Badger Care insurance because of that low reimbursement rate. So this program partnered with the dentist to take on that managing the billing portion of Badger Care and reimbursing the dental providers to allow them to see children in the local offices. And this program still exists to help address that gap in dental access for that population. So still seeing the need to make progress in some of these indicators, and that group continues to, to meet regularly to discuss those local conditions.
Sure. Thank you, Sarah. Yeah, Save a Smile is such a great program. I'm so glad we have that here in our community. We are getting close on time, so I'm going to ask the panelists to please answer your questions briefly, but impactfully, if you will. Jim, this next one is for you. I'd love to get the business answer, if you will, to this question. One interesting thing that I noticed was that the household income for Fond du Lac is slightly lower than the US and our peer communities as well. Why is this an important measure for the community?
Yeah, because household income really is a big driver, especially when we take a look at the retail sector, where they're going to locate, right? So when we look at retailers or restaurants, as they look for communities, they're looking at what is the level of income, what's the disposable income that a community has. As you see on our report, we're just a little bit below the national average. However, household income really, if you look at the report across the board, and pretty much all of the communities represented has increased since 2016, which is a good thing. I would point to some things that are going on here right now. You have the Shopko redevelopment with Big Lots and Hobby Lobby coming to town. You have the mall redevelopment progressing along as well. And then several restaurants have been coming to town. If you look out on the West Johnson Street corridor here in the city of Fond du Lac, as well as other communities in the county, have been seeing activity. And that really comes back to household income. A lot of folks will ask, well, geez, what if we get a Trader Joe's? How come, can we get a Trader Joe's? The answer really lies with disposable income. All of these companies, they look at disposable income. So this is a huge metric for the community. I think it's a big selling point that we have. And I will wrap my comment up by saying, as brokers from outside our community, Fond du Lac is on the map, and it is being noticed, and retailers and restaurants are looking. So a big driver.
Thank you, Joe, or I'm sorry, Jim. I'm so excited to see what will come about in the future, and excited to hear that feedback from you. So thanks, Jim. Satch, the next question is for you. I see you've switched over. Are you all set? Oh, could you unmute your mic, please?
I have.
Mute one of the other computers that you're using, I believe. Larissa is our Zoom master, so I apologize if that wasn't the correct advice.
I don't know if I would say Zoom master, but you got to turn on the volume.
Okay.
Turn down the volume.
Okay.
On.
Can you hear me?
Perfect. Mm-hmm. Yes, we can. Thank you. Okay, Satch,
your
question. Yes, can you hear me?
Yes. Okay.
Terrific. Your question is, you are, fairly new to the Fond du Lac community. Since being here for over a year now, how do you see the Fond du Lac community working collaboratively towards its success of the community?
Thank you, Rebecca. I am delighted to be here, and I didn't know how well-oiled machine, if you will, Fond du Lac community has been, and thank you for including me, you all, into this. And I see are all the organizations that are quite involved in the community's health, working along the same goals, starting out with Fond du Lac Health Department, headed by Kim Mueller, as well as Sarah Faust leading the community health part of it. And they are the ones who kind of get this health assessment survey data. And based on that data, they create goals along with us. And then Living Well Coalition, an all-inclusive organization, also headed by Sarah, along with CSI, the Community Services Integration, and its elements have kind of combined some action plans on those goals. The physical health component by the Living Well Coalition, and the mental health component accentuated by the CSI folks. And those are the two key players in a way to have those action plans set, and then divide that into community/individual health based through the Living Well Coalition partnership, and Jeff Butts and his organization, FABO, and the local businesses employing those action plans, if you will, and creating a healthy structure, not only to individuals in the community, but healthy businesses through healthy employers and employees. And that creates further surveys, which feeds back into the Healthy Fond du Lac to see what the results are of that action. And so overall, this structure has impressed me from the bigger cities that I've come from into this suburban small town, if you will. But it has a lot of stakeholders that are quite involved, including the YMCA with JJ Raflick, Alex Berg, and SSM Health and other healthcare providers. Kara Kerrigan, heading the WIC office and the WIC services. I'm a pediatrician, so I'm quite interested in what children, how they are taken care of. From Becky Hoffman, so far leading the Birth to 3 and Sprout services through their initiatives. All that is so encompassing. We also have, trauma-informed care in terms of toxic stress, through law enforcement, food pantries and farmers market, getting involved with healthy lifestyles and nutrition and so forth. So there are a lot of things going on that are, as well as school district, the Fond du Lac School District and its involvement in optimizing mental health and trauma. So we all need to keep forging ahead together. That I see, so far I've seen quite collaboration for.
Thank you so much, Satch, and welcome again. We're so pleased to have you here in our community. We have 3 more questions, and I'd love to get to answer all of them. Laurice, the Fond du Lac community and its the Fond du Lac County and its peer communities are becoming more diverse. Could you speak to how the Fond du Lac School District has done to address this increase in diversity? Exciting increase, I would say.
Yeah, absolutely. So thus the challenge. I have so much that I could share in response to this question. So I'll just limit my comments to a few things that hopefully are of interest to everyone participating this morning. So one, you'll notice in the Life Report, as you just mentioned, that our schools absolutely are becoming more diverse. A point of excitement is that our schools are certainly outpacing our community. And so we see areas of students of, especially students of color, very much so growing more rapidly than our communities. So in a very short period of time, we'll see a big increase of young adults, working adults, of various backgrounds. And so really as a district, really thinking about and being much more thoughtful, really being strategic in understanding the diverse experiences, as Sarah has mentioned, lived experiences of our students and our families. We know historically many of our diverse populations haven't experienced the same levels of success. And so we absolutely need to think about how we do education different, and we can't be alone in this journey. We are absolutely a big player in the community, and it really takes all of our different sectors working together to make sure that our students and our families are set up for high quality, having high access to high quality education. A couple other points just want to make note of, in particularly what we have been focusing on in the Fond du Lac School District is on page 25 of the Life Report, and looking at the ELA, our English Language Arts data, and talking about on the Ford exam, the proficiency level. And so in the report, and this is our state data from 2018-19, indicating that only 35% of our third graders are reading at or above grade level. And so that's something that absolutely we should all be focused on and thinking about. As we know, as students traverse through the school system, oftentimes that gap does widen. And so, really having focus, how can we all work together and ensuring that our students and our families are receiving the necessary support that we have both in school and out of school to increase that. And furthermore, in thinking about diversity, that's for all students. So we think about our students of color, our students who access free and reduced lunch, our students that are identified with having a disability, our students who are emerging bilingual students. We've had a significant increase in students who are new arrivals or newcomers. That 35% really is actually goes down. And so for each group, and really kind of thinking about what we need to do and thinking about how students experience schools differently. Again, coming back to where I started, really talking about that community partnerships, community collaborations, all working together. Satch did an awesome job really just talking about being focused on a goal for the community. And so that's something I would really like to bring everyone's attention to. And then lastly, I think another perhaps surprise in the data for those who've reviewed all the pieces of data in Life Report so far, and really thinking about the number of students who access free and reduced lunch. That has a number that's certainly increased over time, and we are just peaking, getting close to that 50% mark. So, in the Fond du Lac School District, almost 1 in 2 students is eligible for free and reduced lunch. So that may be surprising, and just kind of really thinking like, what does that mean for our community? How do we work together? And also we also have seen an increase in students experiencing homelessness. That number is, over 130 students already this year have been identified as experiencing homelessness. And so, as we think about how are we responding, it's everything that we do. Each and every student that is in our district and absolutely has the right to, high quality education. And so, really thinking about how we all can focus on that and again, work together in a really thoughtful, meaningful, collaborative ways so that our students are set up for the future of their dreams, the future of their choice, and not having the data dictate what the future holds or limitations.
Thank you so much, Larice. I will give all of you 30 seconds to reply to this question. We'll start with Sarah. Sarah, why is benchmarking our community against others essential in your respective line of work?
I'd say benchmarking our community gives us the opportunity to see if nearby or similar communities to Fond du Lac have seen success in moving the needle in certain outcomes. So I think this really gives us the opportunity then to explore strategies that they're using and to see if that's something that would be able to be tailored to our community locally and implemented effectively. So I think that just encourages innovation and collaboration and improvement with similar communities to us.
Thank you. Satch, how does this deem essential in your respective line of work?
If you don't mind, I'm going to answer that kind of on question 12, so I will save time.
Thank you. Saves me 30 seconds. Jim?
Yeah, benchmarking to what Sarah said, very important. We need to understand what other communities are doing. We need to understand what is working elsewhere. And if we can replicate it, a great example of that was we launched a worker relocation program. That was the result of benchmarking communities across the country. We benchmarked in Vermont, Michigan, Missouri, and Kansas to come up with that program. We needed to understand what was working, what wasn't, and we replicate. That is the greatest form of flattery in economic development, is when you can replicate what someone else is doing. So communities are happy to share what they're doing. I'm happy to share what we're doing, because if Sheboygan County succeeds, we succeed. So benchmarking is critical.
Larice?
Yeah, just, benchmarking absolutely serves a role in helping us understand, the indicators. And so I think in each of our respective areas, the data in the life report, isn't surprising to us in our area, but when we think about the benchmarking opportunity in a comprehensive report like this, it really helps us understand all the different indicators that contribute to our sectors and whatnot. And just one other note I want to make is, also thinking about, I think there's a difference of benchmarking. It helps us monitor our movement, but it's not always what the goal is. And so, I think about in education often, we do see how others are doing, but we want each and every one of our students to experience success. And so the goal's always got to be 100%. So it's not necessarily the state average or the neighboring district or whatnot. We got to keep our goal at 100% and then keep working towards that goal and not leave anyone out.
Yes, thank you. So the next question is for Satch. Why is it important that organizations use this information to collaborate in solving tough social issues or even forging unlikely partnerships? And why is that important or essential in your respective line of work?
So yeah, working together is really essential. And that's what the new mission actually is for SSM Health, for which I work for. So instead of having a volume-based model, now the mission is to have a value-based model system that encompasses all sectors of wraparounds of, let's say, the children that I see, and that value-based model, not only I see the child in my office and kind of strategize according to what I assess and so forth, and then refer to whatever the problem issues are, including school systems, or through birth to 3, or to WIC, nutrition, and so forth, but collaborate all in one encompassing goal of the healthy child. A hallmark of this is caring for the toxic stress that is occurring through COVID. And that begins not at adulthood. Those are all the after effects of these toxic stresses, but it starts in newborn. And there's all kinds of data that even the prenatal period and the toxic stress events of the parent affects the child's health, including mental health. And so we all need to work together, from the OBs, the pediatricians in the healthcare field and beyond, to the WIC services, to the birth to 3, to the YMCA's and Living Well Coalition in terms of physical health, in addition to the mental health, to help optimize children who then will become adults and lessen the chronic disease, the priority that we have, the substance abuse or high-risk behaviors, another priority that FDL has, as well as mental health and personal lives, including school remediation and suspensions starting from preschool stages. So we need to all work together in this one endeavor of how do we improve the mental health capacity of our community in order to be successful within our schools, within our workplaces, within our families. So that's the kind of, in a way, a value-based model that I'm loving that our community is trying to achieve. And we have a lot of stakeholders that are impassioned with this.
Thank you. Thank you so much. We are tight on time. However, we do have a poll ready for everyone to answer. And while the poll is up, I would like to give some closing remarks and some thank yous, if that's all right. Thank you to our report partners, Envision Greater Fond du Lac, Fond du Lac Area Foundation, Fond du Lac Area United Way. Our goal is to continuously update this every 3 years or as we see fit. And just a little sidebar quickly, the life report poll is up on your screen. If you can't see that, please feel free to comment. Also, I'd like to thank Elle Hen, formerly with Envision Greater Fond du Lac, for working so hard to collect all of this data. Our incredible team of panelists who I was so lucky to get to spend my morning with, Larice Snyder, Dr. Sachin Jogal, Sarah Faust, and Jim Cleveland. Thank you all so much for your insight and expertise and knowledge of your sector and how it relates to this life report. Let's see who else. Mercury Marine for underwriting the costs of printing our life report booklets. If you are looking for a paper copy, please feel free to comment in the chat box as well, and we'd be happy to provide you with the information you need to get that paper copy. It is also available digitally. And we'd like to thank our guests. Thank you so much for your commitment to our community through support of this life report and your commitment to spread the word and encourage others. Please continue to learn, continue to inspire people, and make an impact in our community. I'd love to now open it up to the questions in the chat box. I know that we had some people weigh in, and I'm going to ask for some assistance due to technical difficulties. I don't know if I can see the questions.
Rebecca, I don't know if there, I think there are more comments. There are some links in the chat. I don't know if there are any specific questions. So I think we're good there.
All righty. If you do ever have a question after the meeting is over, please feel free to reach out to any one of us. We'd be happy to get you the information that you're looking for or discuss any of this further. Thank you so much for your time this morning. Thank you, panelists. Thank you, Amber, for giving me the opportunity to be your host this morning. And thank you again to all the guests and our partners. Have a great rest of your day, everyone.
Have a great day.